I'm clinician Birungi Raven, and in this video we are going to be looking at hypoglycemia. Hypoglycemia is a deficiency of glucose in the bloodstream. First of all, one needs to know that glucose is the main source of energy in our body. This is usually broken down in the body to yield energy in the form of ATP during glycolysis, which ATP is used to carry out various activities in the body. Hence, if one has a deficiency of glucose, that would imply that the person will fall short of the required energy to support the body activities. This is going to be clinically presented with clinical features which may include muscle weakness, mental confusion, and sweating. In severe cases of hypoglycemia, it tends to result into hypoglycemic coma. Why? Because the glucose level is very low, and remember, the main source of energy to even the brain cells in our body is glucose. That will imply that the brain cells will not have the required glucose to make the required amount of energy for their sustainability, hence result into hypoglycemic coma. Occurrence. Hypoglycemia usually occurs in conditions like diabetes mellitus. In diabetes mellitus, this is a condition where an individual may lack the ability to make their own insulin in the body. Hence, they may require to inject themselves with insulin in order to regulate the glucose levels in the body. If these individuals by mistake or accidentally inject themselves overdose of insulin overdose, this in most cases results into conversion of all the glucose in the body, in the bloodstreams, into glycogen to be stored in the liver, hence resulting into very low glucose levels, blood glucose levels from the norm, hence a condition known as hypoglycemia. Hypoglycemia in diabetes mellitus may also result due to insufficient intake of carbohydrates. If one is taking in very low carbohydrates, remember carbohydrates, the simplest molecule of a carbohydrate is glucose. So it's carbohydrates which are broken down during digestion to form glucose, which is taken up in the body, in the small intestine by absorption. Treatment. So we can treat hypoglycemia by manual administration of glucose. This may be done orally or it may be done by intravenous injections. In the case of minor cases, we do it orally, but in the case of severe cases, that's where we apply the intravenous administration. For adults, intravenous, we give them dextrose IV, that is IV dextrose 25%, 2 mils of that 25% dextrose per kilogram of body weight. So if the individual is 60 kilograms, we shall say 60 times 2, that is 120 mils of dextrose 25%. For children, we are going to be giving them dextrose IV, that is dextrose 10%, 5 mils per kilogram of body weight. Don't forget to like and subscribe. That will be so grateful for this channel. And also don't forget to click the notification button so that we keep you informed and notified whenever we post new interesting videos like this one. Remember, each day we post medical videos of different kinds, and we also post different medical terminologies which have been interpreted like in this video. Thank you.